podcast. I'm excited to welcome to the program World Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. Today's topic is patent ductus arteriosus. What is patent ductus arteriosus?
Well, this is what we call a shunt. In other words, in the uterus, when the baby can't breathe air through its lungs, it gets oxygen from the placenta. And the ductus, the patent ductus, it moves the blood around the lungs, which are in utero useless.
Why do you retain the ductus arteriosus shunt in an adult life?
Well, you actually shouldn't retain it in adult life, but there are times when you want to retain it, and that's if you have some kind of heart defect. But generally speaking, you want the ductus to shrivel up after birth, and it usually does. It usually stops or closes a few days after birth.
What are the risks associated with ductus not closing after birth?
Well, there are several. In the first place, there are a matter of degrees. For example, if you have a very small remaining patent ductus, you have a normal life span and you have normal activity. However, if you have a larger patent ductus, you will probably have endocarditis, myocarditis, and pulmonary hypertension. Now, pulmonary hypertension is a very big problem, and what happens is the heart is really two pumps. It's a low pressure pump on the right side and the high pressure pump on the left side. And those systems are kept separate by valves. But if you mix the two and you get high pressure in your low pressure system, that causes what we call pulmonary hypertension. It's a very serious illness, and it is, if you have enough of it, is not compatible with life.
What are the risks of the ductus closing before birth?
Well, generally speaking, thank goodness that doesn't happen very often, but what keeps the ductus open is prostaglandin. And of course, that's useful in many ways as far as pregnancy goes. If you want the patent ductus to close after birth, you give Indocin, which is an NSAID like Motrin.
What's the treatment?
The treatment to close the ductus after birth is Indocin or indomethacin. It is, like I said, related to Motrin, and that usually works. You do not want to give Motrin or Indocin in the third trimester because you do not want the ductus to close before birth.
When should you see your doctor?
Well, the most important thing to remember is shortness of breath. That's really a fairly serious problem, and for whatever reason, you can have many reasons for being short of breath. Most of them are fairly serious. So shortness of breath, or what we call dyspnea, is a very good reason to see your doctor.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
That was the World Doc Allen podcast, guys.